this simulation is trying to help highlight those issues for people who may not be aware that people have medical access issues.
Drink 40 8-ounce glasses of water. Does that make sense to you? Okay. So.
I feel so much better. Thank you.
Thank you, doctor.
Thank you.
The treatment for this disease is to climb the tallest mountain in South Carolina.
Okay. How are we going to get there, though?
You know what that is? I'm the doctor. I can't help you with getting there. I can't help you with, but if you want your purple phone to go away, that's the way to treat it. So thank you for coming by.
Okay, thanks.
I'm the tallest mountain.
Having to fill out forms over and over again.
Right?
Having people tell you no, sorry, can't help you,
Right.
not give you any other options.
Right. Yeah.
Like there was only certain things that they could either treat, or my plan can only cover certain symptoms.
So as there was no willingness or ability for paying a percentage or a small amount and then having a specific date after that you had to pay the additional amount by.
I didn't really know where to walk to in the room. And
Right.
once you got to a place, they couldn't even help you. Just
Right.
like, well, you might want to try this other place.
Even when you are given information, are you given the correct information?
Right.
Word of mouth, at least in our community, is huge.
Right.
And who will see people and who won't. And there's also some, again, misinformation among people.
Right.
I lucked out when I found the place. They happened to be the right place that specialized in Mozart elbow, and
I had to work out my mind the whole open hours and this weird schedule of mine, and I never even think about timing. It's just
Wishing there was a central location that had like a spreadsheet online where I could just check all the variables and the answer would come out where is the best place I could go. Maybe you go to the ER and they have a screen for people to check all the blanks, and then that's where you should go.
When you go into the clinic, they need to know to have all this information in the front.
Right.
And say, okay, no, I can, let's go. You know,
We're all thinking, well, we'll just go to the internet, we'll just look it up, we'll go online. Well, a majority of people aren't going to even have the wherewithal to do it, even if they went to the library to do
Or they
it.
don't know how to
And they
use it.
certainly may not have it at home. So
Well, it's clear there's no silver bullet, you know, and so your question, what do we do when we go back, is to recognize that if there's no quick fix. This is a systemic problem, and so whatever you're doing, try to touch each of the different areas as best you can.
there is the sense, the depersonalization, even when you go into an office, that I don't deserve to have this. We don't treat this, or you need to,
The biggest frustration for me was that I didn't have a car or a bike or any money to take the bus or a taxi, so I had to walk everywhere I went.
Most of us, we don't have an insurance, and we usually ask our neighbor what to take. It means the auto-medication. So we know that's not the best thing we can do, but it's because we can't pay an insurance.
It kind of brought reality into place where you could realize, what happens to people out there who don't have health care or who don't have access to the system, or there are barriers that they have to face before they can even attempt to get health care.
The suggestion would be to have an information in the front of the door with all that these clinics take care of this. Tun, tun, tun. Listed all the illness.
It's really important to educate the community about the barriers that other people face, so that they can start thinking about ways to solve those issues. This kind of brainstorming is hugely important. Spark some really great conversations at a grassroots level. Even if you don't work in the healthcare industry or work in social services, it's important for you to know what everyone in the community is experiencing right now.